Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. When I use the term foremost authority, I usually use it ironically, as in John is the foremost authority on his own opinion. Today is one of the rare times I could use it unironically, as my guest is one of the foremost authorities on public health. I am delighted and excited to be joined by Dr. Harold Pollack. Dr. Pollack, welcome.
Thanks so much for having me. Great to talk to you.
Yes, really.
Whether I'm the foremost authority, I think is I will appreciate the promotion.
Yes. We're not going to argue with that. I think I can say it. Maybe you feel a little bit reluctant to say it, but I think I can say it. And I have quite a bit of support for that assertion. In any case, brief background. Dr. Harold Pollack is the Helen Ross Distinguished Service Professor at the University of Chicago. He is a faculty co-director of the University of Chicago Health Lab. Dr. Pollack researches services for severely disadvantaged populations of individuals at the interface between Medicaid and the criminal justice system. Beyond his stellar credentials and work, Dr. Pollack's writing has appeared in such publications as The New Republic, The Atlantic, Washington Post, Political, Vox, etc. To me and many others. Those others would include Ezra Klein and the Bulwark's Jonathan Cohn. Harold Pollack is the go-to guy on all issues related to public health. I am sure you're going to push back on that, but I think that also is a safe assumption to make. In any case, again, Harold, I really do appreciate you taking the time. I really was looking forward to this conversation.
As was I, and I should say that I know the people at Chestnut are the best at what they do, and to be on anything that they're doing is also something that I highly value.
On behalf of my colleagues there, thank you. Much appreciated. So, first I want to discuss some general things, and I want to home in on a couple of topics that have been the focus of your recent work, the importance of the victim's voice, where you call for a more rigorous and empathetic lens to our human obligations to crime victims and to persons accused or convicted of crime, and the controversy, which is to say the misunderstandings surrounding harm reductions. But first, if you don't mind, I just want to take a step back. You've had such an amazing and fascinating career, and your original training was in electrical engineering, computer science. What prompted you to pursue a career in health policy?
Well, so my dad was an electrical engineer. In fact, we worked together 2 summers. He worked for a defense contractor called Kierfad in New Jersey. He was a better engineer than I ever was. My first job out of college, I worked designing, helping to evaluate guidance systems at MIT at something called Draper Labs. And I had awesome colleagues there, people. It was very humbling to be in that environment. But while I was there, I started becoming a volunteer at a homeless shelter in Cambridge. And I realized, I was really drawn to that. And finding ways to help people, that are effective, became the thing that became a passion. So I left that job at Draper Lab, and I got a doctorate at the Kennedy School of Government, Harvard Kennedy School, and that's what got me into that. And I should say that after I finished my doctorate, my then girlfriend, now my wife of 34 years, she was working at Yale New Haven Hospital, and she was teaching nursing at Yale, and so I took a health policy postdoc at Yale so I could be with with my wife, and it was right during the height of the crack epidemic in New Haven. It was a very tough time. And I remember people used to ask me, how do you compare Boston and New Haven? And I would say, in New Haven, they get out of their cars to kill you. That, of course, being a reference to Boston drivers. But I really got into the harm reduction work that my Yale colleagues were doing. Yale had a syringe exchange, and it was actually, and Ed Kaplan and Robert Heimer and David Paulty and other people at Yale really were pioneers in understanding what are we accomplishing in harm reduction. And Kaplan and Heimer published some of the very early mathematical models showing that this New Haven syringe exchange really was effective in preventing HIV, and that's really what got me going in my career. So I'll stop there, but that's kind of my story.
Does the electrical engineering computer science work inform the work you've done since?
I got some good training in mathematical modeling, things like that. When I looked at the Ed Kaplan led the mathematical modeling. He's a giant in that area, and that was very comprehensible to me because of the training that I had gotten, in my electrical engineering career. That I could follow the math models and see and found them intuitive. What Ed's work did is he had epidemiological models for how HIV spreads in a population, and if you reduce by a third the probability that someone's going to say someone's sharing there's people who are using drugs together. If you reduce by a third the probability that they are going to transmit HIV over that ripples through the ecology in a way that really has a profound impact. And now it's where the math matters is it turns out that it's a lot harder to prevent things like hepatitis C through that same harm reduction mechanism because hepatitis C is just vastly more efficiently transmitted. So it turned out that syringe exchange is more effective for HIV than for hepatitis C because of the math, and understanding the math
Sure.
was valuable. So some of my early work looked at the questions like that.
Yeah. Interesting. By the way, we'll get to some of your thoughts on harm reduction
Yeah.
as we move through this.
Perfect.
I mentioned when you and I initially spoke
Mhm.
that your New Republic column specifically were my go-to during the ACA debates during the Obama years. Was that your first concerted effort to write for a more general, albeit highly informed, sophisticated audience?
In a lot of ways, I did write for a student paper when I was in college, but that was really my first serious effort. And Jonathan Cohn really was, just did me such a solid by helping me develop that craft. And also Ezra Klein was my editor. Around that time I also published some pieces for American Prospect and some other outlets. And I really respected just the craft of writing. I mean, and there's lots of ways that I need to raise my game in that. But it also helped me, by the way, in my public health career. The quality of your writing is your most controllable thing as a scholar and as someone trying to explain to the public all these important issues. And so it is and I'm sure we'll get to this in the conversation, but one of the ways we can really raise our game as public health practitioners and scholars is to understand how to speak clearly and accurately to broad audiences.
To that point, is there any handy back of the envelope advice you can give to people who are entering the field, who are in the field and are struggling with that?
Yeah, there's a couple things that I think are helpful. One is clarity and simplicity are absolutely key. And by the way, there's a wonderful article in the Atlantic by Derek Thompson called "Why Simple is Smart," where he lays out a lot of those issues. You do not want to be using jargon. The way you impress people is not by using complicated um, vocabulary and stuff like that. It's giving a very crisp explanation of something. That's how you demonstrate you have expertise. And one of the things that really struck me in my electrical engineering and computer science background was if you open up a random physics book to page 458, there's going to be a bunch of math in there that you may find very intimidating. It's written very clearly. They'll say, we're trying to figure out if the electron is going to go to the right or to the left if we did this thing. And there's no professional cachet for making it sound hard. It's like, yeah, no kidding. We're on page 458 of this quantum mechanics book. It's hard. Everyone knows that. Um, the way you show your mastery of the material is you're giving it a simple explanation. And that's what really impresses people. And there are times in the social sciences where we really we we lose sight of those lessons. And if I remember when I was doing my dissertation, my mom asked me what I was doing, and I started to explain it, and And then I said, "Oh, Mom, you just don't have the background for me to fully explain the profundity of my work." And it was just showing I was it was an incredible self-own. I couldn't even explain to my own mom. Now she
Right.
asks me, "What am I doing?" I say, "Well, we're trying to figure out who's going to get into a fight with first responders who has someone who may have a mental health problem. So we have all this data from the city and 911 calls and stuff like that, and we use these computer methods called machine learning to try to predict, what are some things that show up in these calls that predict that someone might get into a fight with a first responder." And she's like, "Oh, that sounds useful." I don't tell her we use this random forest machine learning algorithm because, or whatever. I don't go into the esoterics of
Right.
the thing that wouldn't help her understand it and would be basically just me trying to impress her by dropping the jargon on her. And
Is jargon or lack of, for lack of a better word, intelligibility, does that go beyond the social sciences and maybe just baked into anybody who is cutting their teeth in the world of academia, to the extent that to move through that world, or to go up in that world, it's a function of publishing, right? And volume. And I'm sure there is obviously a quality of scholarship, of course.
mm,
Um, and so in other words, you are communicating to a specialized audience, and there is no pressure even necessarily to be a good teacher and to communicate this in an intelligible way to your students. So is that problem of the ability to communicate clearly sort of baked into that world?
it is baked in, although it's people misperceive what is effective. If you want to impress people who are senior scholars in your own field, clearly communicating something is the way to do it. Now, you, if you're in a group of people, all of whom are familiar with the jargon, using the jargon is part of the clear communication. There's specialized vocabulary in everything that you do, um, but still, it is striking to me how all my mentors at in Harvard, at Yale, where I did my postdoc, at Michigan, where I started, here at Chicago, they're good writers and they're clear writers, and they say, we're worried about issue X, so we use some specialized techniques to deal with issue X, which I'll tell you about, but here's why we were worried, that and there's and people speak pretty plainly. It is, like when you have a junior scholar who's giving their first talk trying to get a job, the most common issue people always have is like, what was this guy doing? Like, he couldn't clearly explain what his dissertation was or whatever. That's not what you want anybody ever to say, So,
Right.
and so my mentees, I think we spend a lot of time talking about, are you clearly communicating this thing? There's going to be some specialized thing that you got in there that uses some advanced method or whatever you're doing. You say that. Uh, you, so there's issues we were trying to show that A caused B, and there were some issues under the hood that came up, and here's how we dealt with it. But
Yeah, I think in that world, your world, if I could say that,
Mhm.
there's a stigma attached, or there's, I guess, a distinction to be made between being a so-called popularizer, and I know
Mhm.
there is a sort of pejorative that attaches to that, and somebody who's just really, really good at communicating.
Yeah. Now, I think there are people who oversimplify and communicate. If you're offering glib generalities that are not accurate, and there's a value in precision, but you can express precision with clarity, and um, so
Yeah, even
mm,
a popular example like Neil deGrasse Tyson, I'm sure
yeah,
takes heat from his colleagues in the world of academia for
yeah,
maybe aligning or simplifying things that are not easily simplified, or that
yeah,
he may be missing a couple of things because he's trying to convey
yeah.
these very complex concepts.
I've had quite a number of dealings with the Chestnut folks who are doing a lot of really critical public health work here in Chicago and Illinois, and Mike Dennis, Chris Grella, other people at Chestnut, quite a large number of people who are leaders in the addiction and mental health space, and and the way that the Chestnut staff deal with people who have mental health issues, substance use issues, very clear. Communicate with people. Here's what we know about an effective treatment for you, and let's do some joint problem solving, figure out how we can get you engaged, keep you engaged, and talking to policymakers and saying, here's what we need to be doing to be effective. So, talking to staff at Cook County Jail, becoming good citizens in the environment there, who are valued partners by not only the people that are getting services, but also the staff and in these facilities, and just really excellent work that's helping a lot of human beings on the ground.
When did you get started? When did you start doing some work with Chestnut? And I'm curious about some of the initiatives that you've collaborated on.
It's been more than 10 years now. I first got to know the Chestnut people, Chris Scott and Mike, when they were helping the city of Chicago with overdose prevention and getting people connected in treatment who were, street drug users with opioid use disorders, and trying to help trying to help EMS and others in Chicago who were sort of on the front lines as the opioid overdose epidemic was really accelerating. I remember Chris in particular. I remember well. She used to go out with the EMS folks, and she was completely fearless and completely concerned about the well-being of everybody. And one of the things that she was very insistent upon is respecting the dignity of everybody. One of the challenges you have in the first response space is that people, the people with opioid use disorders are not always respectfully treated, partly because, you can see the human reaction to a lot of the stuff that's going on the street. You could see if you're a police officer or an EMT, you could see how you become kind of jaded to it. And she was, and that was not the way that she approached these things. And she really helped a lot of people who were, who needed, naloxone, who needed all kinds of specific kinds of help. And that's just where I got to know them. And then when the National Institutes on Drug Abuse funded the Justice Community Opioid Innovation Network, we at University of Chicago were one of the research hubs, and Chestnut was another. So we got to know them. And in fact, they helped us. We were having some trouble with our follow-up in our hub, and we had the Chestnut people come to our lab and talk to us about the techniques that they were effectively using to keep people engaged in interventions. So I got to know the Chestnut people partly because I benefited from their insights when I was trying to do on the ground interventions with people who face the combination of opioid use disorder and criminal justice involvement, which was something that just Chestnut's expert at.
Harold, you recently wrote a powerful piece for the Milbank Quarterly titled Engaging the Victim's Voice in Public Safety Research. In it, you use the term restorative justice. Please define for listeners who are unfamiliar with that concept what you mean or what that means.
So restorative justice is the idea that when someone commits a crime against another person, we want to honor what happened to the victim of that crime, and we also want to bring there's various ways that this is sometimes done in practice. We want to bring the offender and the victim together so that the victim can say, hey, this is what happened to me. This is the harm, and how can we heal this? And the offender can make amends and can be treated with dignity while also being held accountable for the thing that happened. There's a lot of challenges to doing that, in real life. And of course, different crimes, you have different restorative justice has a different place in different kinds of issues that happen to people. But this idea that there's accountability, that the offender makes amends, and that we understand that the way to heal the victims and the other people affected is to acknowledge what happened and address it. But it may, and there needs to be some accountability, but that we honor the humanity of the offender too, in that process. And one of the ways that you honor someone's humanity is you say, "Hey, you're human. Here's what you did. Let's honor that, and let's see how you can accept responsibility for the thing that you did."
Most would assume that the victim's voice is steeped in anger, in a need for retribution, but that's not the case.
And of course, anger, there will be anger. It depends, of course, on the details of what happened. If somebody says, I'm angry at Harvey Weinstein because he raped, my cousin, yeah, of course you're angry.
But I guess the retribution part
Yeah.
is what I'm talking
Um,
about.
well, it is. So one of the things that I talked about in the piece was, my cousin was murdered by a 16-year-old boy. My cousin came home and he walked into his apartment and he encountered the boy and the boy's friend robbing the place. And they panicked and they beat him to death. And this was in a moment of adolescent panic and stupidity, they committed an atrocity and they were caught. And what's really struck me, and I say my cousin was like a brother to my mom. He was a lot older than I was. He was my mom's age. And it really had a tremendous effect on my mom's life that he had been murdered. But what struck me was the way that people described how we're going to honor the victim, we're going to honor the survivors, is we're going to brutalize the perpetrator. That's how we're going to show that we care about you and what happens to you. And this was a 16-year-old boy who did a stupid thing. And what is accomplished for the survivors by doing that? There needs to be some accountability. And one of the things we can talk about is the evidence. People need to know if they do something, if they commit a crime, they're going to get caught. There's a lot of evidence that matters. But this idea that we are going to brutalize the perpetrators to honor the victims, that's not what victims want. And it's not clear that it's evidence based in terms of actually promoting public safety. And obviously there's different things that people do, but so it turns out that then one thing that I cited in that article that you mentioned is there's a very nice article that came out a long time ago by Dan Nagin, who's a leading criminologist, where he basically surveyed the evidence and he said, what really deters crime is people knowing they're going to get caught. If you say there's going to be a 10-year sentence rather than an 8-year sentence, that doesn't really help you that much. But if you say there's a 60% chance of getting caught versus a 40% chance of getting caught, that matters a lot. And the impunity, if people feel they can do things with impunity and not get caught, then you've really eroded deterrence. So I'll stop talking there, but those are the kinds of things that come to my mind there.
Yes. Yes. Back to the topic of communications. In the Milbank piece that you wrote, you said the following, and I quote, "Our political right and left commonly fail to properly engage the victim's voice." End quote. Most people, right and left, who have opinions on the subject have not themselves been victims of violence. It's a belief. It's emotional. So how do you convince the quote unquote tough on crime crowd that being tough is meaningless? It's not a deterrent, as you say, based on that study that indicate that the certainty of apprehension is a more effective deterrent than the severity of punishment. So how do you convince the so-called tough on crime crowd that this is the case? And then
Well,
I
I
want
think
to also ask you, on the left, what are some of the left's blind spots as far as this issue is concerned?
I think both the right and the left have to think about crime in a different way. And so one thing I talk about in the piece, and I'll pardon listeners, I'm going to give a somewhat uncomfortable description. But so I was 17 years old, and I was taking math classes at Columbia University. And so I was on my way to class, and I walked down into the New York subway, and I got attacked by a group of kids. And they wanted to wrest from me my watch, which was a gift from my girlfriend, which I didn't want to give up. And so they started smashing my head against the concrete and kicking me, stomping on me to get, to wrest the watch from me. And I was all bloody. A cop eventually comes and cleans me up. He says, "I don't want you," and I must say he did better trauma-informed care than anybody else that I dealt with that day. But
Right.
he said, I don't want your folks to see you like this." He takes me into this bathroom and he very carefully cleans me up and takes me home. I was very fortunate that I wasn't more badly hurt.
Sure.
But we need one of the things that the left needs to do is it needs to contend with the reality that these things happen. And so when I lead off this Milbank piece by talking about how I was at NIH meeting where people were talking about criminal justice issues, and they said we have to bring in the people with lived experience, by which everyone in the room understood they meant people who've been incarcerated. And that's who we in public health and social work. That's often what we mean by the lived experience. And I was like, I got some other lived experience here that needs to
Right.
be honored.
Right.
And like when I look at things like defund the police as a trope, I teach at the University of Chicago. I am on a campus that is very effectively patrolled by the University of Chicago Police Department. If I go to a seminar, and again, this is in my piece, suppose I go to a seminar on abolitionist approaches to the carceral state. I'm going to walk to my train through an area that's very proficiently patrolled by this University of Chicago police that has security cameras, everything. And then you go 2,000 feet south of that spot, and there's seniors who are afraid to wait for the bus at that same hour. There's just way fewer officers per crime, and there's a sense of impunity about a lot of the crime that's occurring that really affects people profoundly. And the tough on crime people have a point that there needs to be effective deterrence for crime. Where they are wrong is what we need is effective public safety patrolling, things like that. The guy needs to know he's going to get caught if he tries to mug that lady at the bus stop. What we do once we catch him, do we honor that? Hey, this guy's a human being. How do we address that? And putting him in an 8 by 10 foot box for 15 years doesn't accomplish a whole lot to keep the community safe. But him knowing, hey, if I try to do something to somebody out in the community, I'm going to get caught. That does help. And one of the things when I talk to older people in the South Side of Chicago, one of the things that they say is that we want effective police patrolling. We want the police to do their job properly. We want the police not to be racist and not to profile my grandson who's never hurt anybody. But we want the police out here, and that's something that the left really has to contend with too. So I think we all have to learn from each other in a way. And one of the things that I think is really valuable in public health is this idea that you really have to listen to community when you're trying to do stuff, because people disagree with you, and your inclination is to say, I got to explain to that person why they're wrong. And what the real inclination should be is, I got to be curious and understand where's this person coming from? Why are they, what is it? What is happening in their life that is very meaningful to them, that's leading them to express the perspective that they're expressing?
Yeah, you made a really interesting point in our conversation to lead up to this back a number of years ago when you did canvassing door to door.
Yeah.
And talking about, I guess, the time the Affordable Care Act was being debated. And you said, there's nobody who's going to out-debate you on the merits and the facts, the particulars of the healthcare debate. But that's not the issue. The issue isn't winning the debate. It's developing that relationship, which obviously is premised on listening.
Yeah, winning people is so much more important than winning arguments. Winning arguments satisfies your own ego, but there's not a lot of mutual learning that's taking place there. And very often there's a reason why somebody, like if somebody says something about the Affordable Care Act that I think is wrong, there's a reason why they came to believe that. Now, sometimes the reason is that they're watching some stupid political TV that's saying stupid things that's not true. But sometimes it's like, I tried to get into the Obamacare exchange to get insurance, and here was my experience, and it wasn't what I was hoping for.
Right.
And you got to learn from that. And so if you have a conversation with a person, you say, yeah, we got to fix that. But by the way, as we go to fix that, please don't take away people's Medicaid, and because there's a ton of people that need a lot of the stuff about the Affordable Care Act that is really absolutely essential for people. Something that this may come up in the conversation, maybe not. But, my wife and I take care of her brother who lives with an intellectual disability. He's been on Medicaid and Medicare. We need these programs to work well, and we need them to, and we can't be cutting them without. The way you save money in healthcare is you're ultimately reducing services provided to sick people that are spending a lot of money. And people often say we're going to save a huge amount of money in Medicaid by like the trope that sometimes people talk about this 25-year-old guy who's sleeping on the couch at his mom's house and he's on Medicaid. Like, why am I paying for that guy's Medicaid?
Right.
And well, that's a very powerful image because you're like,
Sure.
but when I hear that story, I'm like, that is the cheapest Medicaid recipient in the history of that program. When I talk, it's like, dude, you got to go to the doctor. You got to attend to your health. You're not going to save any money by cutting that guy off of Medicaid because he's, he's a healthy guy who's, who's sleeping on his mom's couch. And
Right.
you save money on Medicaid when you cut services to my brother-in-law, who's got a really expensive condition. He has something called Fragile X syndrome. He's got a lot of medical problems that come with that. That's where the money is in stuff like Medicaid. So if you do a big cut to a program like Medicaid, that's coming from the sick people who are the center of the spending, and we have to find ways to communicate that reality to people in a very straightforward way.
Yeah, you're just in a very, very tough field because I think one of the things that came out of the whole affordable care debate
Mhm.
was how devilishly complex this stuff is, and how
Yeah,
there was just so many counterintuitive elements to try to make policy that makes sense, that's efficient, and all that. And obviously, the tendency in the political classes. On both the left and the right, you talk about an image that's powerful, reducing
yeah,
things to images, which obviously is
yeah,
going to be reductionistic and
yeah,
simplistic, reducing things to slogans like defund the police,
yeah,
when there needs to be a situational awareness. To fund the police means something different depending on the people, the community that's
yeah,
hearing that,
yeah.
right? So I think there needs to be more of a situational element attached to some of this stuff.
I think that's exactly right. And there has to be a willingness to learn from other people and to see you need people who can call you on the things that are wrong with your own arguments. And one of the problems with a polarized political world is that we spend all of our time with people who basically agree with us on most things.
Right,
And so there's no one there to call you on your BS. And yet, one of my favorite, John Stuart Mill's On Liberty is maybe one of my favorite books. And he basically says, if you only know your side of the argument, you know little of that. And
right,
like one of the challenges we have in social work and public health is partly because the conservative movement has aligned behind President Trump and a lot of the really unworthy things that President Trump is doing, for instance, like defunding PEPFAR, things like that, is that he has discredited a lot of arguments that have a conservative valence that have much more that need to be taken seriously. So,
yeah,
like my students are very aware of the abuses that are done by police officers in low-income communities of color. It is a much more uncomfortable topic to talk about. What are some things so like the police unions? My students are very angry at the things that the police unions do that make it hard to hold individual police officers accountable who commit misconduct on the job or who are just bad at being police officers. When I say, well, there's some analogous issues that come up with teachers unions, I get a completely different response from my students, and there's a blind spot there.
right,
And so, like, we kept the schools closed too long during COVID. That was not the public health community that did that. That was the interest groups in public education that did that. And public health communities blamed for that in a lot of ways because initially it was a good idea to close the schools when COVID hit. But there was an unwillingness to look at the evidence. Here in Chicago, our public health commissioner, Allison Arwady, was watching the Catholic schools, which never closed. And she said, hey, it's safe to reopen the public schools. And she was fired for that. She was fired for that by a political coalition that included the teachers' unions. And they kept the schools closed too long. And so we have to listen to each other across these divides more than we do. And we have to figure out how to do that. And
that is the Gordian's knot, and I don't know how that gets addressed. And it's not just in this moment in our culture. I just think it's become almost irreversibly tribal. How do you change that?
well, I think there's some things we can do. And I do think that the tools of cultural competence that the people at Chestnut and others are really good at using, that they provide a useful foundation for that. So, when the people at if you have a young man who's got an opioid use disorder and he should be going to medication opioid use disorder treatment, but his mom says, "Hey, I don't want you replacing one addiction with another. I want you to go to this abstinence-based thing instead." The people at Chestnut are very good at saying, "Well, let's talk about what's going on in tell me your perspective. You, the person with the addiction, and you, mom, tell me your perspectives here, and how do we turn this into joint problem solving? So if the mom says, like my son's selling drugs out of our apartment, and I live in Chicago public housing, and that's putting me in danger, and so sending him to like the syringe exchange doesn't address my problem, which is that he's selling these drugs he's selling drugs so that he can keep buying his heroin. And the Chestnut professional can say, yeah, let's make sure he's not doing that in your apartment because that's putting you in danger when he does that. But let's make sure that let's talk with you about what is the evidence suggest about what's effective here. And here's some things that we think could be helpful to your son, and let's figure out how to make it work. That is respecting people and listening to them, but also communicating to them things that because of your own expertise that is valuable for them. So if you say to them, Mom, we've looked at the evidence around the abstinence-based interventions for people with opioid use disorders, and there's some good things there. The idea they should make amends for some of the things that they've done to other people that come out of their addiction. That's good. We see the value of that. But if your son gets medication treatments and also attends to these behaviors, that's much more likely to actually be effective in the long run than a solely abstinence-based thing. And I think it's building that relationship, talking across lines, etc.
I can see that on the micro level when you're dealing with a family, but when you broaden it out to a community,
Yeah.
I think harm reduction can strike a lot of people as counterintuitive.
Mm-hmm.
You're promoting certain bad behavior to get a perhaps incrementally better outcome. So how do we change minds on harm reduction at scale?
I think listening to community is important, and also not overselling what harm reduction can accomplish. Because like syringe exchange is phenomenal. If you're trying to prevent HIV from spreading in a community, syringe exchange was absolutely essential to do that. And I think that and like the Congressional Black Caucus was the biggest opponent of syringe exchange, and people like Charles Rangel back in the day. And I think that they did cause public health harm because they blocked syringe exchange in a lot of places. At the same time, the reason that they were ambivalent on syringe exchange is because they were concerned about all the other social problems connected to the addiction that syringe exchange wasn't addressing. So I think one of the things that we need to do with harm reduction is we need to say, this is one element of the portfolio. And, we want to make sure that there's not, we don't want people to die of opioid overdose. So we really want everybody to have naloxone so that if they have an overdose, it can be reversed and we can save lives. There are other issues that we also want to attend to that any particular harm reduction intervention may not address. So, we definitely need people to have access to addiction treatment to go with the harm reduction. And in fact, our harm reduction interventions, we're going to try to connect people with treatment when they're ready for it. And we also want to support, strong public safety policies in the community. And we also want to talk to the community about how we do our harm reduction so that it respects other issues going on in the community. Like when in New Haven, there were people at a McDonald's, and they said, I have nothing against your syringe exchange, but if you park it right across from my restaurant, guys are going to go to the syringe exchange, they're going to get their syringes, and they're going to come into my men's room, and they're going to shoot up in my men's room, and that causes a problem for me. And so let's do some joint problem solving about where we cite the syringe exchange. If we ask the participants, we say, please make sure that you respect that McDonald's and what they need to be doing in there. And so implementing harm reduction in a way that takes seriously why the community might be ambivalent. Like, it is striking. Like if you go to Seattle, San Francisco, lots of cities in America, you see a lot of public dysregulated behavior by people with behavioral health challenges. And I stayed in a hotel in the Tenderloin district of San Francisco, and it was I walked out of my hotel. There was a guy smoking crack right outside the door, and there were people, just a lot of disturbing stuff going on. And so one of the things one of the ways that we earn the respect of communities with harm reduction is we say, it's completely appropriate to regulate harmful behavior or scary behavior in public places. And we see why, that mom walking with her 5-year-old kid doesn't want to have some guy screaming at her, who's has a behavioral health challenge. So we'll do some joint problem solving with the community to figure out how to address those things. And we'll also try to communicate to the community, well, there are some, as a piece of the puzzle, a lot of these harm reduction interventions are helpful. Um, we keep, they're a way to create relationship with people. They're a way to deal with some of the really severe problems that people are having if they have an addiction disorder. There's most people who have addiction disorders are not hurting other people. They're trying to live their lives, and if we can help them do that in a way that is safe and socially productive, we'll all benefit from that. And certainly, like, very brutal criminal justice treatment of people who have an addiction disorder, we don't accomplish a whole lot with that. And so when someone's got a small amount of drugs that they're using for personal use, what am I gaining by incarcerating that person? Very little.
But it is such an emotionally charged issue, so
Yeah.
it's hard getting people to come to that. I mentioned when we first spoke that in addition to reading your New Republic columns, etc., I used to check you out on Blogging Heads with Professor Glenn Laurie. And before this, I went back to some of those. And the other day, I was listening to you talking about, this is in 2016, 2017, and you were talking about this book you had just written called The Index Card, Why Personal Finance Doesn't Have to Be Complicated. And when I brought that up to you, that book, I said, it sounds kind of far afield from the work that you do. And you said, no, it really is not.
That's correct. That's right. I never thought about personal finance at all until I was age 40. I remember I was recruited to the University of Chicago from my previous job at the University of Michigan. I remember and I had no money whatsoever, but the University of Chicago helped me with the down payment on my house as kind of the incentive for me to come. And I remember I got on one of these mortgage calculator websites, and it said you can buy a $460,000 house. And so I started looking at $460,000 houses, and the university sent me to this mortgage professional at Harris Bank. And I had just gotten tenure, so I was in that "don't you know who I am" phase, and I'm talking kind of at this speed. And at some point, I stopped, and this guy says, "Dr. Pollack, I have to tell you something." And I said, "Oh, what's that?" And he said, "You're not a good customer. The University of Chicago is a good customer, and they asked me to talk to you, so I'm talking to you. But dude, you're 40 years old. You have no money except what the University of Chicago has just given you help with the down payment. And if you decide to leave the University of Chicago, they're going to ask for that back. And it's ridiculous. I'm not going to give you a mortgage for a $460,000 house. It's ridiculous." By the way, I should say he was the most honest financial professional that I dealt with, because this was just before the mortgage meltdown, the 2008. And I'm sure I could have found somebody that would have given me that mortgage.
Sure, absolutely. Right.
We ended up buying a house that was far cheaper than that. And then 4 months after we moved into our house, my mother-in-law died quite tragically, and still quite young. And her son, my wife's brother, who lives with an intellectual disability, we had to take him into our house. And I remember our bathroom scales went up to 340 pounds. And so he would step on the scale and it would say 340. And we had to buy all new furniture for him, just given his size. And I remember I bought this very expensive Lazy Boy recliner chair that was designed for large people. I think it was like $900, something like that. And I remember just thinking, I'm going to hemorrhage out my money. Thank God this guy at Harris Bank saved me from myself, and I don't have this ridiculous mortgage payment. And I started to look at the literature on investing and saving. And what was striking to me was that what the real pros were saying was very simple, and it didn't require you didn't have to become an expert on the stock market or anything like that. In fact, quite the opposite. being an expert at the stock market was kind of like knowing how all the machines worked at the back of the casino, and just not what you wanted to be doing.
Right.
And and I remember I got on. I had a blog at the time, the reality based community. I was one of the contributors to, and I interviewed this personal finance writer named Helene Owen, and I said, "Isn't the problem that the personal finance advice industry has is that the best advice is available for free at the library and it would fit on an index card. It was all stuff like buy, low fee index funds, stuff like that. And so, and so this thing goes up and I started getting all these emails and they were like, dude, where's the card? And of course I was just kind of woofing when I said it would fit on an index card, but I took out one of my daughter's index cards. She was in seventh grade at the time. And I just wrote in like 2 minutes, I just wrote 9 things on a card and I took a picture with my iPhone and I posted it on the web and it got 400,000 hits.
Wow.
And I remember Ezra Klein and lots of websites were like really promoting this.
You need to write a
And,
book.
yeah. And it was, and I remember my colleagues at the University of Chicago who are the real experts on the stock market and stuff like that. In the University of Chicago, we always all these Nobel laureates and stuff. Our business school is one of the world centers of that research. They were like, "Oh, I heard you won. I won Money Magazine's Best New Idea of the Year award for the card." And they were like, "I heard you won this award from Money Magazine. What did you do?" And I showed them the card, and they were like, "What are you talking? This is like, whoa! This is also like, you got to be kidding me. This is also obvious." And I was like, "That's the point. It's it's showing people the obvious thing in a way that people can understand it. You can take this card, you can put it on your refrigerator, and it's all stuff like pay off your credit card at the end of the month, stuff like that. And that's what's helpful to people. And I think that's something that we learn in public health. If someone has an opioid use disorder, say, here's what we know that works. There's some stuff under the hood, like you say, why does methadone work this way rather than that way? Of course, there's complexity to it. Um, but the but what people have to know is, here's where methadone is helpful. And one of the things that was really striking in the index card thing was that the low fee index fund that you buy in your retirement outperforms 3/4 of the funds that claim that they can outperform the market. And there's just a simplicity to that is very helpful for people.
But one of the things that's interesting that you talk about here
Mm.
is we were talking about how slogans sort of paint things with a broad brush and they don't take different situations and communities and their concerns into account.
Yeah.
But here, as far as personal finance, you also make the point that a lot of how we manage our money is a function of our upbringing, our culture, and some
Yeah.
of those things and how you need to get out from under that. So if you could speak to that a little bit. And also, mentioned to you when I came across this work of yours, that I had done some work around this time in the area of financial wellness. And I also found that that was a problem of communication because people conflated and didn't understand the difference between financial planning and financial wellness. They're obviously points of intersection, but they are very different things.
Yeah, it is. I mean, there's so many different ways we could take that. And whatever is going on in your culture, whatever's going on in your life, it has a way of showing up in your money in such a profound way. By the way, I say all the people that we work with who have addiction disorders or mental health issues, they also have tremendous financial challenges that come with that. If you have an impulsivity issue that's leading you to that's making it harder for you to deal with some of your substance use issues, that also the impulsivity is showing up in the way you're buying stuff and taking your credit card out when you shouldn't be taking your credit card out and stuff like that. There's And one of the things that really struck me after I wrote the book is people would come to me in my life and they would ask me for financial advice. And it was so often tied up with things like their relationships, things like that. Like someone would say, I've been with my girlfriend now for 8 months. We know what each other did last summer. We have each other's Facebook passwords, whatever. How do I talk to her about the fact that this $5,000 credit card bill that I haven't paid off? Or I just discovered my partner has this $5,000 credit card bill. And it's funny. And some of the financial gurus, I remember I once watched Susie Orman. I watched her on TV, and she's now, I think a lot of people listening to this may not, I may be giving a dated reference at this point, but she was giving advice that was mathematically not so great for how you should invest, but it was psychologically very attuned to stuff. She was saying stuff like, don't do retail therapy, don't let your boyfriend manage your money, don't live in debt. Her investing advice was too conservative for a lot of people in a lot of ways, but she helped a huge number of people because she was helping people deal with a lot of the issues that were getting them into financial trouble. And a lot of people, the problem is not that they invest their stock portfolio in the wrong way. It's that they have this big credit card balance that they never paid off, or they let their boyfriend manage their money, or whatever. And she really spoke to that directly. And she's like, women, you have to be independent. You can't be dependent on a man for your money stuff. That's not a good long-term strategy.
The book was written in what, 2017?
A little before that, but
Or
it's
before
been out for
that?
about 10 years.
Okay, so it feels like it may need some updating, no?
Yep. We were too conservative about stocks for what happened later. Although in this current moment, who knows? But a lot of the advice we gave was pretty sound, and there's also things that when I think about where it intersects with my other work, like things like how do you manage your own spending so that you're not overspending to impress other people, and the sort of the, like I live in a $340,000 house in the Southland of Chicago, and a lot of my peers, particularly people who live in Boston or live in a big coastal city, they're like, "Is something wrong in your life? Why do you live in such a cheap house?"
Right.
And I want to tell them, "Hey, your computer on your desk is so cheap. Why is something wrong in your life?" But it is. And I think by one of the things we could do better in academia and in lots of other realms is to watch out for the way that we encourage overspending. Like when I go to academic conferences where every session is talking about the evils of American inequality, and the conference itself people are spending $2,000 to go to it, and it's in a super expensive coastal city when we could have it in Cleveland or Akron, and talk about poverty in places where the conference would be a lot more economical, and where we'd just be around a lot more people that are the low income people that we're trying to help. So there's ways we could be more reflective as an academic community and a research community about our junket cultures when
Ah,
in this domain.
all right. So heal thyself,
Yes.
fellow professors and academics. I can't help from asking about AI. I don't know if this has direct bearing on your work, but it's such a ubiquitous thing on so
Hmm.
many levels. It's
Hmm.
eddied into just about every phase of work and
Hmm.
life. So let me ask you just sort of a general question. How does AI intersect with the work you do? What are your thoughts on where this is all headed?
That's such a great question, and AI is such a large bundle of things. I mean, the way that I personally have used AI, I kind of use AI in two different ways in my own research. One is we do use the big data methods to try to identify people that are in need of services. So we so we have a study that's coming out in a journal of quantitative criminology. Zubin Delv is the first author on this, and Andrea Tentner's also on it, two of my colleagues, where we tried to predict who was at risk of having a behavioral health crisis in Chicago that involved where there was a police involvement. And if we can predict those people, then we can potentially do some proactive social service interventions before that happens. And we used AI methods. We had massive data sets from 911 calls, and we were able to identify the top 1% of people. We had data for what we call a training interval, and then we had the outcome interval. And we were trying to predict who in that outcome interval had some sort of a police involved behavioral health crisis. And what we found was that in our top 1%, the group of people that we identified as being in our top 1% at risk, 28% of the people we identified had not previously had a behavioral health crisis where the police had to be called. So we actually could do prevention because there were things about other encounters they had that were warning signs. And so the AI was quite helpful in helping us in that way. So the big data tools can be quite helpful. I think the other issue is that a lot of people are using chatbots and so on as therapeutic interventions, and then there's pluses and minuses to that. I think that there's definitely a lot of people who are saying, I asked when I had this personal challenge, and I asked ChatGPT about it, and it gave me pretty sensible advice. And so I think there's lots of ways that AI is showing up as tools for people, also for making people more clinically productive. The AI scribes when people are in health encounters can be valuable. So then I think there's pluses and minuses to it, of course, because there's going to be cases where chatbots are giving bad advice to
Sure.
people, or if you had a human being involved, they could follow up with, and especially in like there's some real issues around suicidality and chatbots.
Yeah. Is there another dimension to this? For instance, years ago, when we were talking about the internet, we spoke about the digital divide and how there were some people who were disadvantaged, they didn't have access, and obviously some of the impacts of that. Is there anything analogous as far as AI to talk? I mean, there may be a digital divide as far as accessibility to AI tools, to chatbots, and so forth. Any thoughts on that?
That's a good question. I think it's a segmented question. There's, I mean, I think everyone is exposed to AI now. AI is so that it's not what we used to think of as the digital divide is now fundamentally different, because whatever you're doing, AI is, if you're on Facebook, AI is tracking your whatever's.
Right. So that's also segmented. It's the ubiquitous AI that's sort of embedded into everything, but there's also the tool that you're intentionally using in a particular way.
Yeah, I think that how helping us train up our kids for the valuable and to understand the valuable and the toxic aspects of AI is important. And it is there's a business model where people use AI to sell you stuff that's not good for you, and that gamifies day trading and sports betting and so on, where AI becomes a tool, for predatory marketing. I mean, when I see ads for sports betting where this guy's on his phone and betting on some same day parlay or something, and and you look at that, especially if you have an addiction background, you're like, wow, they're using the AI to create addiction cues for people to be getting in over their heads in sports betting. And so I think there's a need for regulatory action. You have same as we have tobacco marketing, things like that. There's also
Should have
marketing.
AI inside like a warning label.
Yeah, I mean it is, but I think it's complicated, and I think it's because there's definitely benefit to AI in a lot of ways, but there's also, like everything else, it has to be properly regulated and scrutinized.
Yeah, I always thought, I shouldn't say always, because it's a fairly new issue and problem, that when people are interacting with a chatbot, and as we know, and as you're sort of alluding to, you develop these relationships. It feels like there's sentience on the other
Mm.
side. There's a relationship. I thought it would be a good policy to make sure that all of the chatbots at certain fixed intervals, maybe every 12 minutes, there is sort of a commercial
Mm.
message. This is your chat, just to remind
Yeah,
you
yeah,
that this is a chat bot. This is not Sam or Sue on the other line engaging you in an organic, natural conversation.
yeah. I think that's quite, and I'm sure that ChatGPT and other vendors, that that's going to be a live issue with regulators.
Is there anything that you're currently working on? Any study that you're currently embarked on any projects you want to discuss? Give us a little sneak preview.
We have to figure out how to deal with the partisan divide and how it shows up in public supports for evidence-based interventions to help people with addictions. And there's the opiate epidemic is less racialized than the crack epidemic was when I started, but we still see very strong partisan divides, and we have to figure out how to the public health community has to figure out how to work across that divide, and so that we can engage more effectively conservative communities and constituencies. And we saw that during COVID, but we also see that in the opiate epidemic. And just very large differences. And if you ask people, like, do you support using Medicaid to help people with addiction disorders? Very large partisan divides there, and we have to figure out how to cross that. That's one thing. And
It's like, it's, I'm sorry, Harold, but what's so interesting about that, as the case with so much polling, when you ask a question like that, you can expect it to track based on your political affiliation. But when you break that out and you ask some other questions, you may get some differences. You may get
yeah,
some people who would otherwise say yes to that would say, well, no, I think that that's a good thing. Yes, that's a good thing. That's so the components of it poll better. Maybe there needs to be more of an effort. Again, it goes back to that sloganeering. It's very convenient, and we understand the impulse to reduce things to bumper stickers, but that's really just going to get people on a visceral level. To really get at the issues, you got to dig in. You got to talk about, well, what, like Affordable Care Act. Ask people particulars, what's actually in it, the things that it's trying to address. You get a very different response.
I think that's right. And but you have to also you have to have you have to have trusted messengers across in lots of different communities who can organically communicate what needs to be said and who you're listening to so that you can be genuine in that communication. I want to think when Ohio's Governor John Kasich expanded Medicaid, when the Affordable Care Act was passed, and he actually had Planned Parenthood and Ohio pro-life people behind him. And basically what the pro-life people said, who supported that, they said, we want people to know I'm pregnant. If I have this child, my health care and this child's health care will be addressed. We don't want people as people who are pro-life, we want people to know that we don't want people to feel that if they are pregnant and they have a child, that they're going to be left on their own with a set of really challenging life burdens. Because of course, that's going to lead people to terminate pregnancies when
Right.
that's happening. And one thing, being a caregiver for someone with intellectual disability, one of the things that really strikes me is people of every political background have really extended themselves for our family and for other families um, in just a profound way. I took my brother-in-law Vincent on a vacation to Los Angeles, and we went on this bus tour, which was the Hollywood Mansions gawking bus tour. We went past a lot of the homes of celebrities, and while we were out on this tour, at some point somebody taps me on the shoulder, and they said, we're from this Latter-day Saints church group. We see you're here with your friend. He's obviously got a disability. Why don't you join our group? And that way, if you want us to watch him, if you have to go off, do something or whatever, we got you covered. And you're welcome to join us. And I've had a lot of experiences like that where people of faith who I might disagree with on various political things extend themselves for me because they believe that that's what you do, Matthew 25, and I think that it is very inspiring to me when I see that aspect of my life with intellectual disabilities. I wish I could see that more in other domains, but I think that we want to honor that there's people of excellent values across the political spectrum who are helping other people, who are people that I want to have a relationship with, and to understand that our disagreements should not define everything in our relationship with those people. And I think we have, in social work and public health, we have not always understood or embraced the importance of having of reaching out in all those ways. And we view our job as explaining to people why they're wrong, as opposed to listening to people a little bit more than we should. It's a complication because sometimes, like, there's people who don't, there's people who want to mistreat people who are LGBTQ or whatever, where you say, hey, wait a minute, we have to honor everybody's humanity. But I think that that's something that I would love to see us raise our game in.
Yeah, it just feels like you're swimming upstream. On the one hand, you have a lot of very loud voices who are spreading disinformation, and you talk about John Kasich. I mean, he's always been a bit of an outlier. He's always been a bit of a maverick.
Mm,
So it
mm.
it really requires, I'm going to say, political courage and different. But like for instance, I find, and not to make a partisan point here, James Tallarico
Yeah.
has a very interesting and important voice, and I think he's bringing something to this debate. Maybe not necessarily public health policy, but probably is that as well. Somebody who could combine faith and politics and try to be as inclusive as he possibly can. So people like that, and of course he's young, so that kind of gives me hope.
I must say, I was thinking about him, and and it's funny, I'm Jewish. I'm not Christian, but when I think about Matthew 25, which is the kind of verse that Talrico would be quoting, I was a stranger, you did not welcome me. I was hungry, you did not feed me. He sees the kind of the radical implications of Christian scripture. The least, if you say I'm committed to the least of these, that's what we do in public health. We are trying to help every human, and what they're saying there is pretty clear. It's like, you if you are blessed, if you have resources, you have a responsibility to other people. Like one of the things that I found so inspiring, I was not a George W. Bush supporter in any way, but when he did PEPFAR, he basically said, we have all these resources in the United States, and there's people around the world who are dying of AIDS. And with a very, very modest investment of our own resources, we can save millions of lives, which he did. And he got a Christian constituency behind that to really save a lot of people. One of the things that is so challenging about the current moment is the exact opposite mentality that is now that the Trump administration is representing. There was I'll mention one anecdote in the Washington Post where there were 117,000 rape kits there were medical kits that were available for sexual assault survivors that were destined to go to East Africa. And it had things like PrEP if someone was at risk of HIV, things like that. And it was going to cost $2 million to transport these $117,000 rape kits. And they decided not to spend the $2 million. And so reporters from the Washington Post went to East Africa and they found a young woman who was raped. And she went to a clinic and they did not have the equipment to give her the PrEP, whatever, because it was never delivered. And then lo and behold, she became HIV positive and pregnant. And I'm just thinking that is the most unchristian thing that you could possibly do these things it would have cost $15 per kit or something like that, maybe $17, whatever 2 million divided by 117,000 is. And they didn't do it. And I think we have to call that out, but we have to call that out in a way that honors the values of people across the society in that. And I do think one of the challenges we have in this moment is to very emphatically stand up for the vulnerable people who are being harmed by so many of the current policies, but to do that in a way that does not accentuate the polarization. And I think finding good people across the divides that we can work with. And I think Mr. Talrico is just I like what he's doing there.
Harold, I'm going to leave it here
Yeah.
because I like ending these things on a positive note. And I think this is also kind of, in a way, a good summation of the amazing work you've done over these many decades.
Mm.
So, and I really do want to thank you for taking as much time as you have to talk about all these issues. As I said, I've been looking forward to this. Long a fan of your work. So thank you so much, Harold.
Well, thank you so much for having me. And as I said, the Chestnut people are the best at what they do, and there's so many people that have been helped by, and there's so much good research that's being done as well. So I'm very, very proud to be asked to be in conversation in that universe.
Oh, thanks so much, Harold. Today, I spoke with Dr. Harold Pollack, the Helen Ross Distinguished Service Professor at the University of Chicago. He is also faculty co-director of the University of Chicago Health Lab. And as I said at the outset of this podcast, one of the foremost authorities on public health. This is Charles Epstein from the Catalyst Podcast. Thanks for listening.